and COVID numbers may be falling across the country, but in the northeastern states, they are proving to be an exception. Of 73 districts nationwide that still have a positivity rate of 10%, 47 or 64% are in the 8 states of the northeast. This includes Sikkim, and the Health Ministry's data for the week beginning the 29th of June is alarming. At least 4 out of the 8 states have a higher case fatality rate than the national average, and the rate of vaccinations in some of these states is dismal. Ratnadeep Chaudhary reports from Guwahati on why the second wave of COVID is refusing to ebb in this region.
Even now, the second wave is not over for the northeast. Another important challenge is that because it is mountainous region, the villages and towns are spread out far. So ensuring that proper ambulance tie-up and timely shifting of patient to that extent will become a critical element. Focusing on timely testing will become a critical element.
The news for the Northeast is not good. 1 out of every 10 COVID-19 samples tested is turning out to be positive at a time when numbers are falling across the country. And that's not all. 18 districts in Arunachal Pradesh have 10% plus positivity. So also 9 districts in Manipur, 6 in Meghalaya and 2 in Assam. 4 northeastern states have a higher case fatality rate than the national average of 1.32. Even deaths per million is higher in 2 northeastern states compared to the national average of 293. Manipur says 398. Sikkim is a whopping 451. From this week, Golaghat and 6 other districts of Assam are in total lockdown. It's the first time the state has imposed a total lockdown in the second wave.
There was no complete lockdown except some restrictions. We think that that is one of the cause of not going down COVID numbers. And another reason behind this, because the new strain is highly infectious. This time, more rural areas and remote areas are infected.
On the vaccination front, Tripura and Sikkim have done well, administering dose 1 in the 45 plus category to 99 and 90% respectively. The national average is 46. The 2 states are also best performers in the 45 plus second dose category in the northeast. But the figures for other 6 states is dismal. Worst performers Manipur, Nagaland, Meghalaya and Assam. Their numbers in single digits against a national average of 57%. The number of fully vaccinated healthcare workers is wanting. So is vaccination for other frontline workers.
I have right now a patient of brain tumor from Meghalaya, which is just 3.5 months old and who is COVID positive. So it is affecting all age groups from old to the... So we need to actually worry, because are we really getting a third wave in Northeast, or the second wave will merge into the third wave of the country?
Some tough measures are being put in place. Only fully vaccinated people can enter Arunachal Pradesh. Assam has set up teams in every major town to enforce COVID restrictions. The Delta variant is also prevalent in the region. On top of it, you have low vaccination coverage, and therefore authorities are now trying to act up. But it seems a new strategy will be required to see how the government can check the spread of the virus and get the number of cases in the region climb down. In Guwahati, Ratnadeep Chaudhary for NDTV.